The following program was recorded at the 2018 National Medicare and Senior Insurance Product Sales Summit held June 12th in St. Louis, Missouri. To access other videos recorded at association conferences, go to www.medicaresupp.org/library. The American Association for Medicare Supplement Insurance maintains the nation's #1 online lookup for consumers searching for local Medigap agents. For details on getting listed, visit the association's website. Now, enjoy the program.
Okay, so our next presenter is John Green. John is the VP of Congressional Affairs for the Association of Health Underwriters. So he's going to spend about 30 minutes with us this morning, so we'll turn it over to John.
All right, thank you. So I am from the swamp in DC. This is what the swamp looks like. And we get a lot of criticism from the people out here and also from members of Congress. But let me tell you something. It's part of our First Amendment right to try to protect the business that you're in. And you often hear about that we're trying to sneak things into bills and such as that, right? But it's really a lot about what doesn't happen, bad things. So, for example, some of you may be familiar with the 120.4.4, the override issue. So let me tell you something. It's not about Congress, it's about federal agencies and how CMS is organized. It's a very siloed place, and it's divided between a lot of career people and then political appointees. Let me tell you who runs this place. It's the career people. They are very, very smart, very dedicated group to the bennies, as they refer to beneficiaries. But it's a public program. And so they think about things, and then they create regulations that affect all of us. Scope of appointments, right? They think that you should get 1/12 of a commission based on when you sign a new beneficiary up for MA coverage. Why? Because this is what they sit around thinking about. And so what we do is we try to make those things not happen if we are aware of it. And we were aware of the 120.4.4. And when the new administration came in, I thought, well, I might have an ally here, because I'm admittedly a Republican. I have a Democratic colleague in the office who handles that side of the aisle. But so I had friends, I've been doing this a long time, who are now part of the administration. And I said, hey, if you do this thing, you saw those numbers about MA, they're going to go like this. They're not going to go up. If you crush the override, it would just be devastating. And they took note of that, and they crushed it. So, but this is something that happens behind closed doors, kind of quiet work that we do that doesn't get in a Washington Post or published anywhere. So I'm working on a bill right now, and I just call it the broker bill, because I work for the National Association of Health Underwriters, representing agents like yourself, many of you. And the scope of appointment, listen, I lobbied on the MMA in 2002 and 2003 because we thought getting a drug benefit for seniors was the right thing to do. And we got that really nifty sidecar of the health savings accounts, which we really liked too. But our question all along was, would the government be a good business partner, right? We're trying to introduce private sector ideas into a program that some of the earlier graphs that you saw where there were dips in the Medicare, that was Medicare plus choice, if you remember, those of you who've been in the business a long time. And basically Democrats starved that program and carriers left. And when Tom Scully, who was the administrator for CMS at the time, testified before Congress as we were working on the MMA, he said, these carriers will never come. It just won't happen. And guess what? They came in droves. They came in such vast numbers that they were actually considering.
If you'd like to watch the rest of this program, as well as benefit from watching all sessions recorded at the 2018 National Medicare and Senior Insurance Sales Summit, go to www.medicaresupp.org/sell more for access information.